What do business owners and all Americans need to understand about the latest CDC guidance as cases reach their highest level on record? With me now is NYU Associate Professor of Medicine, Dr. Devi Nampiaparampil. Did I get that right? I think so.
Yes.
It seems very infectious, seems very scary for a lot of folks, but should we be as concerned as we were from the start of the pandemic to now?
Well, the hospitalizations and the death rates, those have been coming down compared to earlier in the pandemic. So case for case, things seem to be safer. Of course, we still have to take precautions. I mean, when I look around, what I see people arguing about most are masks and vaccines, but there's still basic precautions that we can follow. I mean, we had New Year's Eve last night, and I saw crowds of people waiting in line for COVID testing mixed in with people waiting in line to get to Times Square here. So that just as a basic principle looks unsafe. So if you see people who are sick, who have symptoms, just being vaccinated or wearing a mask is not going to protect you. You have to follow basic infection control practices.
Right.
I think another thing that we have to be aware of, too. I mean, we usually think about things in terms of medicine, and of course now people are much more aware of politics. But I think what's happening is that people are starting to see a lot of the other, things that are affecting it, just as the last person was speaking about, workers' compensation issues, liability, how it's affecting all of the businesses. There's so many factors. It's such a complex situation that I think we're going to see a lot of ripple effects as this continues in 2022.
So, Doctor, for those people who are vaccinated, it seems that this Omicron variant causes minor flu symptoms, which is a good sign. Is that also a good sign looking out for other mutations going forward? Can we read something into this?
Well, as the viruses evolve, just historically, they tend to become less deadly and more contagious. That's because they're trying to adapt. They're trying to adapt so they can survive. So just as we've been coming up with new treatments, vaccines, new technology to try to defeat the virus, they're also trying to figure out how they can adapt to become more effective. So if they become more contagious, they can spread more effectively, but they don't want to kill the host because then they die at the same time, right? So over time, they will cause milder symptoms. And COVID, it may be different, but there's no reason right now to think that it would be. So over time, we will see more variants. It's not that if we defeat Omicron, that suddenly it will be over.
Yeah, so, Doctor, let's turn to those treatments you talked about. The FDA has been slower to approve treatments for COVID-19 than, say, vaccines and boosters, it seems. On Monday, we're expecting the FDA to approve the Pfizer booster for people 12 to 15 years old, as well as approving boosters for kids 5 to 11 shortly after. But new treatments have sort of taken a back seat. It took the FDA months to approve Pfizer's treatment, for example. Has the FDA failed to adapt with the adaptation of the COVID variants?
Well, we can't say that the FDA should automatically approve treatments. I mean, we still have to look at the data, but I do think that the failure has been primarily in distribution. So when we've had these treatments, for example, the monoclonal antibodies that are out there and that are FDA approved, we should have ramped up production as soon as they got FDA approval, and perhaps even before that, as soon as there were studies that showed that they could be effective, because there shouldn't be such a shortage at this stage when we're 2 years into the pandemic. On top of that, there's not enough public awareness. I mean, most people who get diagnosed with COVID, it seems that they don't get access to these treatments immediately. They have to know about the treatment and then go in search of it. It shouldn't be that way. It should be that the person who is performing the test and gets the positive result, the healthcare provider, is the one that immediately orders the treatment for the patient.
So in the last 15 seconds, doctors, back to the vaccines, are we going to get stuck now with a fourth, a fifth booster, a sixth booster every 6 months?
It's hard to know what will happen, but I think as a strategy, it makes more sense if we want to overcome the variants to offer those vaccines to other developing nations so that people who want access to the vaccine can have it, because the virus doesn't know about these borders. So if people who can get one shot can get it, that has a better chance of stopping the virus from forming more mutations.
Okay. Thanks, Doctor. I appreciate it. Happy New Year to you. I don't have my insurance card yet, the new one, but that copay will come to your office in a couple of weeks. I appreciate it. Thank you, Doctor. Thanks for getting up this morning.
Thank you.
Yeah.